All right, new fears tonight that fraud investigation fallout could cause a lapse in care for Minnesotans with autism.
The Department of Human Services acknowledges to us a backlog in service approvals in the Early Intensive Developmental and Behavioral Intervention Program. It was one of 14 flagged as high risk for fraud last year.
And one provider tells Richard Reeve he's using his own money to keep up and running. Rich is live at DHS headquarters in St. Paul.
Yeah, Lindsay, that's right. One provider tells us he gets up to $90,000 every 2 weeks from Medicaid reimbursements. But he says for the last 2 months, he has not seen a penny. He's concerned for his clients, but also trying to keep his practice open.
He has profound autism. He's severely disabled. He hits himself.
Scott Carlson is worried about a gap in services for his son. 19-year-old Grant is now a client of Behavioral Dimensions in St. Louis Park, but he'll soon be aging out of being able to get services.
Any disruption, any delay in his services right now are twofold because they're going to have that much more of an impact.
But that disruption is already happening.
There's an incredible backlog on these individual treatment plans or prior authorizations being approved.
Company founder Jay O'Neill says that approval has to come from Essentra, a third-party provider hired by the DHS to approve a diagnosis and treatment. The program allows providers to be reimbursed with Medicaid funding.
And if they're not approved, we cannot get paid.
What's the normal turnaround for these reports?
Under 10 days.
And where are they now?
We are waiting on authorizations that we submitted on July 1st.
O'Neill says he received this letter Tuesday from DHS, acknowledging longer than required timelines for those authorizations, due to an increase in review volume. The agency says it's increasing review capacity, improving workflow efficiency, and prioritizing cases to reduce that backlog.
So a third of the kids right now are not authorized to receive services.
Dr. Eric Larson with the Autism Treatment Association of Minnesota believes Essentra is trying to catch up with a flood of revalidated providers with not enough people to process paperwork. He says about 300 out of 500 Minnesota providers are revalidated, but about 1,000 kids are still waiting.
So right now, 1,000 of the 3,000 children don't have their paperwork processed. Not because the providers haven't submitted it, but because it's sitting on a desk somewhere.
Now, we're still working to learn more details about DHS's plan to speed up those approvals and to find out if there's some kind of a workaround for those providers who haven't heard back from Essentra. Meanwhile, O'Neill says he has two big issues he's dealing with, trying to provide care without that Medicaid funding and to make payroll for his 75 employees. Live in St. Paul, Richard Reeve, 5 Eyewitness News.
That is really tough, Rich. Thank you.